next speaker is Gregg Gilbert, who's the National Director of the National Dental Practice-Based Research Network. Gregg is at the University of Alabama in Birmingham, and he's going to give an introduction, a brief overview of the PBRN.
Thank you. So in the next 5 minutes, I'm going to focus on orienting you to the National Dental PBRN and orienting you to the PBRN context in general. So some of you are not familiar with either one. Some of you are familiar with both. So we're going to focus on orientation in about the next 5 minutes. So what is a PBRN and why should we care? Well, the message from this slide is that research contexts exist along a continuum. So at one end of the continuum is laboratory research, in vitro, animal research. So this is the research context to engage if you have an intervention that is not ready for humans. Progress to clinical trials in academic settings. This is the context to engage if you have an intervention that is not ready for patients. PBRNs, if you have an intervention that is not ready for practices. Community-based research, if you have an intervention that's not ready for communities. So in the academic health center clinical trials setting, this typically focuses on efficacy, not effectiveness, but efficacy. And by efficacy, we simply mean, can an intervention work under ideal conditions? So you typically have highly selected patients in a clinical environment that is not operating under financial constraints, time constraints from the real world. You typically have practitioners who are highly trained, they're specialized or super specialized. But this is the place to do the research if you need to investigate efficacy. Can it work under ideal conditions? If you want to investigate effectiveness, then do it in the PBRN. By effectiveness, we're investigating, does the intervention work under real-world conditions where just about everyone receives their care? So real-world conditions, the typical conditions, the typical patients, the typical financial and operating constraints. So does it work in the real world, okay? So the take-home message is that every one of these research contexts has important strengths, and every one has significant limitations. So if you want to advance a research agenda overall, you're probably best going to need to engage all 4 of these contexts. I love this quote: if we want more evidence-based practice, we need more practice-based evidence. So the old model is that academic types like myself would dream up projects, we'd focus on doing them well, we'd publish them, and then those study results would sit on the virtual shelf and be promptly ignored by clinicians. PBRN is just the opposite. We make a point of engaging the end user from the outset. After all, we're producing this information, we're producing this evidence so that the end user will actually use it. We want the end user to look at the results and say, this can actually make a difference in what I do in my practice tomorrow. Not a decade from now. This result can actually make a difference in what I do tomorrow. So that is why we make a point of engaging the end user, also known as the clinician, sometimes the patient. We are organized as a single unified national network. We have 6 regions. A lot of our activity is focused at the regional level. We do integrate across nationally certain tasks. If you have a study idea, the typical pathway is to approach someone in your region, typically the regional director. So we really do make a point of engaging the end user, the practitioner, at every step of the process. And our research is dramatically improved as a result of doing that. From the outset, and every step after that. And I can tell you that practitioners are excellent at generating ideas for studies, developing study design. Who would have thought it? Maybe just academic types should be doing that? No. Practitioners actually have a lot to offer. The old model essentially ignored this immense amount of practical clinical wisdom that's out in the community with practitioners. Thank goodness now we're actually engaging that practical clinical wisdom in the entire research process. They have tremendous input on designing data collection forms, feasibility testing, pilot testing, data collection, data analysis, and yes, they are often very good at presentations, being the ones up at the front of the room instead of just listening in the audience, as well as participate in manuscript preparation. These are the top 5 reasons that practitioners tell us that they like engaging the network and being part of it. So these are not things that academic types like myself have dreamed up. These are what practitioners tell us. They say they like participating in network research because it increases the stature of their practice. It sets them apart. They're special. It conveys to patients that they stay current. It provides new, rewarding collegial interactions. They're compensated for the time doing the research. Now, the typical project is about treatment that they're going to do anyway. So what we're compensating them for is the time spent doing informed consent, completing data collection forms, that sort of thing. And they like the fact that they can participate as much or as little as they want. They might not be interested in all the studies. They might not want to make room in their practice to participate in all studies, maybe just one at a time. That's okay, no problem. If you have an idea, then this is an overview of the study development process. It's on our website, and this is intended just to provide an overview. The starting point is to engage typically a regional director in your region, talk about it, put something on paper, and engage in discussion and move it from there. I encourage you to enroll if you haven't enrolled. It's a simple process. Simply go to the website, go to Enroll Now. You can see what the questionnaire is like on the website before you take it if you like. With our practitioners, we emphasize kind of a customer service approach. We want to make research easy for them, not burdensome. So we engage them at every step of the process, at every step of the way, and I think it makes it fun and rewarding for them. Wouldn't it be nice, a great vision, if 20 years hence a dentist is at a social gathering, someone comes up, oh, you're a dentist? Do you happen to do research? And the dentist is kind of taken back. Well, yes, of course I do research. I'm a dentist. That's just part of what we do as a profession. Well, this is a way to make that happen. Thank you.